This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Monday morning, Mon Health Talk on 104.5 FM, 1440 AM WHAR. Thanks for joining us. I'm Kyle Wiggs, and our guest this morning on Mon Health Talk Radio is Regan Siko, Oncology Service Line Director with Mon Health. And Regan, good morning. Thanks for coming on the program.
Good morning, Kyle. Thank you for having me.
We appreciate your time. Well, first of all, I know you've done this before, but give us a little bit on your background.
So I am from Morgantown, kind of by way of a lot of different states, Pennsylvania, Ohio, Illinois, Utah, then Wheeling. But I moved here junior year high school, went to University High, and been here ever since.
All right. And what drew you to Mon Health?
I think being from Morgantown and in this community, it's always been Mon Health is the hospital you go to if you're from Morgantown. It's that community feel. It's that personalized care. And when I grew up here, I wanted to get involved in healthcare. I went to school at WVU for my undergrad and master's degree, and I really saw the difference at Mon Health, and I knew this is where I wanted to be.
Okay. And we're going to get into the low-dose CT scans in a moment because November is Lung Cancer Awareness. But describe your job. What's your day-to-day job? What are the things that you get into each and every day?
So as the Oncology Service Line Director for Mon Health System, I am responsible for the operational and financial decision-making throughout the health system for our Oncology Service Line. I'm also the Managing Director of the Cancer Center here in Morgantown. So I have the Gynecologic Oncology Office, Medical Oncology Office, Radiation Oncology Office, and Infusion Center here in Morgantown. But on top of that, I implement new services. When we implemented the low-dose lung cancer screening program, that was up to me to kind of, conceptualize it, come up with the software and the financial piece of it and to implement it. So that's what I do.
So new services, cancer treatment, it seems, has kind of revolutionized, it seems like, just in the last couple of years. Can you put into perspective the inroads and the advancements that have been made just recently?
I think it's ever-changing, and that's a wonderful thing about cancers. There's new research coming out all the time. There's everything from immunotherapies. We often see those commercials about the Keytruda, different kind of steering away from the chemotherapies into the immunotherapies. We're looking at biosimilars. And then we go into even radiation, where we're adding new services to offer those here at the medical center with high-dose HDR radiation therapy and SBRTs and different things like that. So we're always looking to provide the best care for our patients. We've added the Monarch system here at Mon Health in the last few years, which is a very robotic way to be able to get and biopsy pulmonary nodules with advanced technology. We were the first in northern West Virginia to have that. And we're always looking. You can come to Mon Health and you think it's a community hospital, but you're really getting the top cancer care technology and treatments available, just like you were at a large center anywhere.
Right. Okay. So November is Lung Cancer Awareness Month. Tell us about the low-dose CT scans. What exactly are they? How do they work?
So what the low-dose CT scans are is they're part of a lung cancer screening program. People often think about, women think about, I have to get my mammograms. This is kind of the same thing where they're screening for breast cancer, but we're screening for lung cancer. And we do that with low-dose CT scans. So lung cancer is the lung cancer screening is a way in which doctors check the lungs for early signs of cancer in people who have no symptoms of lung cancer. They're a CT scan that creates a picture inside the body. A low-dose CT scan uses much less radiation than a typical CT scan and shows a lot more detailed images of the lungs than just a standard X-ray alone.
Mm-hmm. Okay, so you mentioned that many patients don't show symptoms. So how would I know that it's time for one of these? How do I know that it might be appropriate for me to get checked?
We are really targeting with this program smokers. 90% of lung cancer is due to smoking, and lung cancer is the number one cancer in the state of West Virginia. So the low-dose lung cancer screening program, we are looking for those smokers. There's really long-term and heavy smokers.
Okay, so even if you have quit, right? Even if you quit a long time ago, it might be a good idea to get screened.
Absolutely. There's criteria for these scans. Current or former smoker, and a former smoker, but you can have quit in the last 15 years.
Okay, what about people that have been around secondhand smoke? If you've been married to a spouse for years, or if you were a child of someone whose parents smoked and you were just around it. You don't smoke yourself, but you've been around it most of your life.
So this program doesn't specifically target those people. We're really targeting those people that were active heavy smokers.
Okay.
And former active heavy smokers.
All right. You mentioned the criteria, and it's changed, right? What about it has changed, and how has it changed?
It has. So we go by the Medicare rules. So to make sure that when the scan is authorized, that it gets paid for by your insurance companies. But the criteria is for current or former smokers. Former smoker must have quit in the last 15 years. You need to be between the ages of 50 and 77 years old. Formerly, it was 55, so they lowered that age level. You have to be completely asymptomatic. That means no symptoms. People often think, well, I have a cough or shortness of breath. At that point, you should really reach out to your primary care provider or pulmonologist to get what's called diagnostic treatment and diagnostic imaging and workup. This is to look for that before you have those symptoms. We really want to catch things at the earliest possible stage, because that's the best course for recovery and treatment. The other piece of it is that you have to have a tobacco history of at least 20 pack years.
Okay, define that.
So a pack year is the amount of cigarettes you smoked per day multiplied by the years someone smoked. So if you smoked a pack a day for 20 years, that's a 20-pack year. Or if you smoked 2 packs a day for 10 years, that's also a 20-pack year.
You've dealt with a lot of people who have smoked a lot. Can they break it down that much? Like, do they know? How close can they get or estimate as to how much they've smoked? Do most smokers know that?
I think pretty much people who have smoked know that. They can say, well, I smoked, for 20, 30 years. Well, how much did you smoke? There's 20 cigarettes in a pack of cigarettes. So if you smoke half a pack a day, 10 cigarettes a day. People are pretty consistent. They know how many pack of cigarettes a day they buy or go through. So they're pretty good at actually being able to tell you how much they've smoked.
Okay. How much of a difference can it make if you catch something, a potential problem, before it becomes a major problem or before the person becomes symptomatic?
So the main benefit of screening is that it helps doctors find cancer early. When it's generally, again, easier to treat. Screenings are done with no symptoms, and if finding it at an early stage might lower your chances of actually dying from lung cancer. We're looking at probably a 20% reduction in death rate according to the American Lung Association, if you can catch it at the screening phase.
Wow, that's significant. I mean, that's
Very
really significant. Is there any difference between males and females in terms of smokers? I know it's a little bit of a nebulous question, but does this affect women different than it affects men?
So there is a risk that increases with age, and then there is males more than females with small cell lung cancer. So we really see that males more than females, and then we really see with small cell lung cancer between the ages of 60 and 80 years old.
Wow. Okay. Small cell, what are the different types of lung cancer?
So there's small cell, non-small cell, and then it kind of gets a little bit more into subdivisions. It just is basically the cell type, and it just affects what type of chemotherapy and treatments and surgical options and radiation that we look at to treat those types of cancers.
All right. Before we take this break here, we've got a break coming up. How can people, if they've listened to you over the last 15 minutes and they say, I'm a candidate for this, I fit that criteria, how would they go about getting this screening?
The best thing to do is to reach out to your primary care physician, and they can have what's called a shared decision-making visit with you. Make sure you meet those criteria. Go over counsel you of the importance of, quitting smoking or staying abstinence from smoking. They'll cover the benefits and harms of screening, the possibility of diagnostic testing, false positive rate, total radiation exposure, and the real importance to adhere to the lung cancer screening program. And that patients need to be willing to undergo diagnosis and treatment after that screening happens. And if you don't have a primary care provider, you can call Mon Health, and we can get you set up with one in your community.
What about smoking cessation? Are there programs that are available for people that want to quit?
There is. There's a great program if you're from the state of West Virginia. It's called the West Virginia Tobacco Quit Line. You can call 1-800-QUIT-NOW. They offer smoking cessation counseling. They offer free, nicotine patches and gum to help you quit smoking. And if you go through the counseling, they'll do follow-up counseling with you. So there's great programs. And the thing about the West Virginia Tobacco Quit Line is they're actually starting to reach into the world of vaping. So,
okay.
Great.
Well, that was going to be – we'll save that for the next segment. I wanted to kind of get into that in terms of how that affects people differently than smoking. One more thing before we take the break. Make your pitch for people out there who I know it's easier said than done, but the moment you stop smoking, you become healthier. So kind of make your pitch if you can to get people to wad them up and throw them in the trash.
The best way to prevent and to make yourself healthier and prevent lung cancer is to, number one, stop smoking. Stop now. Never too late to stop. Stop smoking. It will decrease your rate of lung cancer. Your lungs, you'll start to breathe better. You'll start to feel better. When you smoke, your veins and your arteries are restricted. You have problem with wound healing. There's all kinds of effects that smoking has on you. And number one, if there's anything that you can do for yourself and your health, it's to quit smoking, and you need to quit now. Simple
as that. I know it's easier said than done for people who quite frankly are addicted to it, have the nicotine thing, but it's just as simple as that. You quit smoking, you become healthier. All right, we are with Regan Siko, Oncology Service Line Director with Mon Health. This is Mon Health Talk Radio. We'll take a quick break and continue the conversation coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
We are back on Mon Health Talk with Regan Siko, Oncology Service Line Director with Mon Health. November is Lung Cancer Awareness Month, and we're discussing the low-dose CT screenings. And Regan, welcome back to the program. Again, thanks for your time this morning.
Thanks, Kyle.
Can you describe this procedure, what it's like?
Sure. So it's if anybody that's had imaging or scan done, you would come in. They would lay you down on a table. The CT scanner looks like a big donut. So it's not contained like an MRI where you would go into a tube. It's like a big donut. They lay you down, make sure you're comfortable and warm, and then you would be very still. They move the body through the scanner, kind of slide you through the donut, and then move you back out. And that's it.
Okay. What are the risks involved, if any?
So the risks of going through the screening process are really, false positives. They might see something on the scanner that may result in, more imaging needing being done, maybe a biopsy. Just worry from that, and then, more appointments with doctors, and then, of course, radiation exposure. But with these low-dose CTs, they have less radiation exposure than a normal CT scan does.
Right, thus low-dose CT screenings.
Correct.
Exactly. Okay, so if something does pop up, what are the next steps?
So with the low-dose lung cancer screening program, we will send you a letter telling you the results of your scan, and if you had any findings. Sometimes if something is found, we just may recommend to follow up maybe in 3 months or 6 months for another scan, but nothing else needs to be done at that time. We might also say that you need to have a follow-up appointment with a pulmonologist for further workup. But whatever the findings are, you will get notice. The ordering provider who ordered your test, which is usually your primary care physician, we'll call you with those results and go over what the next steps are.
Okay. So, and again, you mentioned before the potential for a false positive, that was something that would be worked out as well through the process, correct?
Absolutely. I think a big thing that people don't realize about the low-dose lung cancer screening program is they think it's a one and done. They think, well, I get one CT and then I'm done. It is just like a mammogram in the sense that you get one every year until you either age out or you've been a non-smoker for over 15 years or become symptomatic. It is something that needs to be done annually. You may not have any findings on, the one from last year, but the next year may be the one when we find something. And again, we're looking for those nodules or those findings at the earliest possible stage so we can really have your best chances as treatment and recovery.
Okay, so if you've been a smoker, this is it, the low-dose CT scan, again, if you fit the criteria that we discussed in the first portion of the program. All right, well, Regan, this program focusing on lung cancer and specifically the low-dose CT scan, and I know it's the biggest killer in West Virginia, but in terms of other cancers, I know you encourage women to continually get the mammograms, and men, I know prostate cancer is a huge deal. The best way for that, is it still getting the blood work and the PSA checked?
Absolutely. And then women, go get your pap smears. When you get your pap smears, make sure you ask for that HPV test to be run as well. That is the precursor to cervical cancer. So people don't like going to the doctor, but those preventative screenings are really the best way to catch anything at the earliest stages and have your best chance of recovery. Okay,
so cancer screening, very, very important. And again, like we talked about before, treatments have evolved. It seems like they're less invasive now. It seems like they're more successful now. That's no guarantee, obviously, but you mentioned the survival rate increasing for lung cancer patients who get these diagnoses early. So, it does seem like cancer treatment has evolved significantly just in the last few years.
It really has. In West Virginia, with being such a high state with lung cancer, we're below the national average for screening. National average is about 6% for screening. We're less than 4% for screening for lung cancer. We really need to get the numbers up. You really need to ask your physician about screening and going through the program. It really, really might just save your life.
Okay, so stop smoking. That's the first step. And, again, go through your primary care physician or contact Mon Health if you believe that you fit the criteria for this low-dose CT scanning. Regan, anything we missed?
I think you got it all.
All right, very good. That sounds good. Again, we appreciate your time, and we've been visiting with the Regan Siko, Oncology Service Line Director with Mon Health on Mon Health Talk Radio. Regan, again, great information, and thanks.
Thank you.
That is Mon Health Talk for this Monday morning. Thanks for listening to the show, and join us again next Monday here on WAJR.